Brian, Stephen, thanks so much for taking a minute to sit down with me. I know you've had a very busy week here at AAMI in committee meetings and otherwise. So before we get started, maybe you could take just a minute and introduce yourselves and let folks know who you are and what committees you're active in and your role there. So, Stephen, you want to kick us off?
Yeah. I'm Stephen Dain. I'm an anesthesiologist from London, Ontario, Canada. I'm the chair of ISO TC 121, which is the overarching committee of the subcommittees that are meeting here this week. I'm an adjunct professor of systems design and engineering at the University of Waterloo in Waterloo, Ontario, Canada, and I'm Chief Medical Informatics Officer at DocBox, an ICU integrated clinical environment company based in Waltham, Massachusetts. And thank you very much for having us today.
Absolutely. I would ask what you do in your spare time, but you don't have any based on that list of activities. So you want to introduce yourself and
Sure.
take us forward?
I'm Brian MacLachlan. I'm Chief Engineer at Stryker Instruments Division. Okay. And I work with plume evacuation systems there. And so I'm on the working group that focuses on plume evacuation system standards here. Working Group 7 underneath Subcommittee 6, and we roll up to TC 121.
Got it. And how long have you been doing that work, Brian? How long have you been involved in standards?
Started in 2018, so about 4 years.
Okay. And Stephen?
It will be 30 years next year.
All right, there you go. That not quite as long as AAMI's been around, but a good portion of the time that AAMI's been around. Yep. So tell folks a little bit about the activities since you sit at the upper level of that structure of working groups and committees. Tell folks a little bit about how that works and what was happening this week. What committee meetings were taking place?
The Technical Committee 121's Anesthesia and Respiratory Care Committee, and as a committee with all the subcommittees and working groups, we have over 100 standards under our purview. A lot of very, very able experts and that provide their expertise in writing these standards over the years, and it ranges every way from plume evacuation systems. We're here this week also with SC2, our subcommittee 2, which is airways and related devices that endotracheal tubes, oral airways, masks, and other components of ventilators and anesthetic systems. There's the SC1 has the anesthetic equipment that's not meeting this week, and then SC3 takes in all the critical care ventilators, sleep apnea therapy devices, home care therapy devices, alarm systems. So quite a big breadth. SC4 overlooks the vocabulary of all the committees within SC1 so that we have a standard dictionary of terms from which all the committees can draw. SC6 looks after medical gas pipelines that are the infrastructure in hospitals. SC7, I was actually handed a box of materials, the history of one of the retiring members that participated from the very beginning. Working group, Subcommittee 7 was OR pollution, which actually had rolled into your committee many years ago, and SC8 looks after suction devices, and both from a hospital perspective and from a small device perspective. So that's the large picture. I've been here this week participating in SC2 and SC6, in some ways providing guidance to both books and as a cheerleader and thank everybody for their time and participation and their expertise.
And so how many of the groups were actually meeting? That this was SC1 through 8, right? And I think there was one in there that maybe is folded in. So how many of those groups were actually meeting this week? All of them?
No, it was just SC2 and then working group of SC2.
Okay.
And SC6 and a couple of working groups of SC6.
And I didn't mean to turn it into a quiz. No. This is quite a puzzle of activities, but it's useful for people to understand the breadth the scope of what you all are working on. So you were actively involved, you said, in one of the working groups. So what were you guys working on? What were some of the key issues you're dealing with in these meetings?
Yeah, so the working group is really kind of the nuts and bolts, right, where you focus on a specific scope or specific project. And so our project is revising that plume evacuation standard. So we are in the middle of another iteration of working on the second edition of this standard that's out there. So it's still pretty young in just looking at the second edition here. So we have, in this iteration, we're treating the comments that came back from circulating that around for people to review. And so we have to, as a working group, take those comments and decide what to do about them and how we want to update that standard. Right now it's at the committee draft level, and we're going to elevate that next to back up to the DIS level, or the Draft International Standard level.
Okay. So what are some of the key topics? You guys have had a very busy couple of years in the areas that you were just describing that these groups focus on. So has that produced a lot of change? What are some of the key topics you're dealing with across all of the working groups? What can you share with us kind of about the general direction, especially given what we just went through with the pandemic?
When COVID hit, AAMI and ISO TC 121 sort of mobilized, brought their forces together, and particularly with the FDA emergency use authorization that then allowed a number of new entrants into the field, particularly early on. There was great concerns about the potential inadequacy of the number of ventilators. There was a lot of people wanting to build ventilators, wanted to build resuscitator use I call them ambu bag squeezers. And what we did is the AAMI organized a team of experts from the anesthesia and respiratory committees here in the United States under the auspices of AAMI and from ISO TC 121, and we went through our standards and sort of distilled down what is really important for a newly starting research group, manufacturer, somebody working in their garage, to how to build the ventilator. What are the basic requirements for ventilators, and then created an extensive website of resources for people to look at with ventilators. One of the things we were looking at is potentially remote control of ventilators, which has been a project that I've been working on, particularly in providing some guidelines and safety standards for this. Other committees, put resources towards PPEs and requirements for gowns and gloves, and requirements for sterilization. This is not part of our committee, but this is what some of the things that were done. So, it's and we spoke to a lot of people that were very interested in making ventilators and discouraging.
Right. It was good to have a lot of volunteers.
Lots of volunteers, but
good human spirit.
And a lot of people that were trying to, do things in people's best interest, but not a whole lot of expertise behind them, particularly.
So I'll throw this out to both of you. Were there things that came out of all of that activity, and it was amazing watching that unfold as it took place, and those resources were not surprisingly some of the most downloaded resources or accessed, utilized resources AAMI's ever put out there. Mm-hmm. So thanks for making all of that available, and the same's true for other committees that did the same. But so that was a specific time, a specific need. Are you guys seeing things that are changing the practice, changing the standards going forward as a result of what we learned over the last few years? Or is it back to business as normal and sort of the regular march of progress in the standards development? What are your thoughts on that?
It's interesting. My purview is certainly a lot more narrow than Dr. Dain's purview, but for plume evacuation standards in general, the goal there is really improving the air quality in the OR and the danger associated with those airborne particulates that are produced by electrosurgical devices. When COVID hit, it really brought a lot of focus to airborne contaminants in the form of the virus, right? And ingesting that from a respiratory perspective. So I think for this, for our working group in Subcommittee 6, where we look at these plume evacuation devices, I think there's a little bit more awareness that, we need to worry about the air quality standards in our operating theaters because of that heightened, I think, sensitivity and awareness that came from the pandemic.
Yeah.
So definitely have an impact over the long term.
And what we're dealing with operating room pollution and with what Brian's dealing with, operating room pollution and ICU pollution. How can you improve the air quality? Because every time you cauterize a wound, you get smoke, or laser attacks, laser a lesion, you get smoke coming up, and that smoke has been shown to contain viruses and bacteria.
Oh, that's interesting. I didn't realize that
one of the concerns, one of the big initial concerns was actually hepatitis, spread of hepatitis virus, and the spread of herpes virus. There's a lot of the lasering was of herpetic lesions initially, and that OR personnel were developing herpes lesions on their lips
from the smoke.
From the smoke.
That's unbelievable.
And then with the COVID coming in, we're using the lessons learned in the OR with the plume evacuation for the number of years. How can we then further it to assist in reducing viral particles
from all kinds of contaminants,
and from different procedures.
Wow. So are there any expected, you mentioned where you were in your process, and, I'm an outsider to this process, but certainly an observer and supporter. Doesn't mean it's coming out tomorrow where you are in the process, but maybe 23 could be before we get to the end of the year. But are there any documents that we know we want to let folks about that we're sure are coming along in a sort of short order, 23 or thereabouts?
There's a lot.
And I know we're not signing a contract here of when that would be, but
no, there's a lot of work being done currently in updating the 100 standards that are within the purview of 121. Some of the overall electrical safety changes have forced us to update the standards. So the critical care ventilators standards coming out. One of the standards that recently came out and was hurried along and done in record time was the high flow oxygen therapy standard. Over the past couple of years, we've also got a ventilator vocabulary standard, which is assisted in things. Home care ventilation is a very, very big field with sleep apnea therapy devices and CPAP machines. Those are moving along, updating the manual resuscitator standards that the fire departments and the paramedics use in their day-to-day practice will also be published. Updates will be published shortly.
Okay, so a lot coming from this committee or group of committees,
Yes.
Fantastic.
The new anesthetic machine standard, workstation standard, will be also forthcoming shortly.
Wow, fantastic. So any last thoughts or words? We have folks watch these that might be thinking about getting involved in standards. Any special words to folks that might need more information about getting involved with the committees, et cetera? Anything you want to say on that front?
I was new to this about 4 years ago, and so for those that are considering getting involved, I don't regret it. I think it's a great opportunity to help promote improvement in industry and healthcare, to connect with a lot of other experts in other areas, and certainly within Subcommittee 6, with which I participate. I'm only familiar with one aspect of the many different devices that they that they're concerned with, but that's okay. I contribute where I can, and then that's kind of the goal.
So you don't have to have this kind of encyclopedic knowledge over the entire spectrum to be a useful contributor. Yeah,
that's right.
Deep subject matter expertise is really, really applicable. So. Yep. Yeah, fantastic. Well, thank you both for I know you're not done yet. I know you have to go over there and do more work. So thanks for taking the time to sit down with me and share with folks kind of where you are and what you're working on. And we greatly appreciate it.
Yeah, and thanks for AAMI for hosting us this week and hosting our TC 121 as the sponsoring organization.
Absolutely.
Yep.
Glad to do it.
Us.
Thank you so much.
Okay.